Dr. Tam, who is the Chief Public Health Officer at the Public Health Agency, and Dr. Howard New, who is Deputy Chief Public Health Officer at Canada's Public Health Agency. Before I turn to my colleague, Minister Anand, let me summarize briefly what the Prime Minister said this morning. First, that there is light at the end of the tunnel. We are obviously focused very much on the short-term epidemic and the crisis. We obviously also want to keep in mind that there will be an end in this tunnel, and that spring will come and better conditions for everyone will occur, and that will happen more quickly if we continue to look after each other, follow closely the public health advice, and not to travel. Le Premier ministre a été très clair tout à l'heure.
The Prime Minister was quite clear earlier. The directives have always been the same. Avoid non-essential travel, certainly those outside the country, in order to protect your own health and also protect the health of those around you.
General Fortin will have further information to share with us. However, the key objective is the same, is to vaccinate every Canadian that wants to be vaccinated by September. Our medium-term objective also remains the same, to have Canadians being delivered 6 million vaccines by the end of March, and that being done in the most rapid and the most efficient manner, but also in full collaboration with provinces and territories that have the important and challenging and difficult work to administer the doses in Canadians' arms. Et en terminant, le Premier ministre.
And in closing, the Prime Minister also mentioned two important messages. Firstly, the link between people's health and our economic health. We learned that over the course of the pandemic, and we will keep this in mind, that while looking after people's health, we will also be looking after our economic health. He also alluded to the fact that once we're through this public health crisis, there is an environmental crisis that we will continue to work on to ensure, as we've always said, our environmental health is also linked to our economic health.
I would now be pleased to turn to my colleague, Anita, for her remarks.
Merci beaucoup.
Thank you very much, Jean-Yves. Hello, everyone.
Let me begin by thanking Canadians for following public health guidance to help slow the spread of the virus at this pivotal time. The sacrifices being made to protect families, friends, and fellow citizens are very difficult, but essential. En plus des vaccins qui seront essentiels pour
On top of the vaccines that are essential to conquer COVID-19, we must continue to adhere to the guidance that Dr. Tam and New continue to share.
A diversified vaccine procurement approach. Given global demand for products emanating from a limited number of suppliers, we knew that we would likely need to weather challenges with supply, given complex manufacturing, unprecedented global demand, and rapid acceleration to peak production. We clearly saw this last week with news from Pfizer of temporary disruption delays. This was very disappointing, and I spent the weekend on the phone with Pfizer executives and my team. We reiterated firmly the importance for Canada to return to our regular delivery schedule as soon as possible. Pfizer assured us that it is deploying all efforts to do just that. This is an evolving situation, but I will continue to update Canadians as soon as I have additional information. This is the reason that I'm here today and that I will return to continue to update Canadians. Il est important de se rappeler cependant.
It is important to remember, however, that this is a temporary delay. Canada will receive its full allotment of doses this quarter. While this news may be viewed as a setback, I want to remind Canadians where we stand.
In addition to Pfizer, we continue to receive steady deliveries of Moderna doses, those deliveries remain on track. By the end of March, we too, as a country, will remain on track. We expect to have 6 million doses of Moderna and Pfizer in Canada and 80 million doses by the end of the year, the vast majority of which will be delivered before the end of September. And we have agreements in place for 5 additional vaccine candidates, which we will bring to Canada as soon as possible once they receive regulatory approval. Let me be very clear in terms of assuring Canadians. We will have enough vaccines in Canada for everyone who wishes to be vaccinated prior to the end of September 2021. Over the coming months, especially into the spring, Canadians, including the provinces and territories, will begin to see a dramatic increase in vaccine deliveries. Au cours des prochains mois, surtout au printemps,
Over the coming months, especially into the spring, Canadians will begin to see a dramatic increase in vaccine deliveries.
we will see additional supply challenges along the way. And again, this is precisely why we have multiple agreements in place with multiple manufacturers. The road forward may not be as straight and smooth as we would like, but we will together cross the finish line. By working together, we will succeed. We will overcome COVID-19 and get through this together. Thank you so much. Magwech. Merci beaucoup.
Merci beaucoup, Anita.
Thank you very much, Anita. Major General Fortin.
Major Général Fortin, votre caméra est...
Major General Fortin, your camera and sound are both disabled.
Désolé. Ça devait arriver une fois, ça m'est arrivé à moi.
So sorry, it had to happen once and it happened to me. Hello, ladies and gentlemen. I'd like to talk to you about Pfizer, the reduction in doses, and tell you a bit about Moderna too. So first of all, in terms of the reduction of the Pfizer doses, I'd like to thank you for your comprehension. And as we work on Pfizer's fluctuating availability over the coming weeks, as announced Friday, and as reiterated by the minister just now. It's a fairly major reduction in Pfizer doses for over the next 3 weeks, and then things will return to normal. There will be considerable impact in all provinces, of course. The overall impact over the coming month means that we'll receive 50% fewer doses than we expected, and this impact will vary from 1 week to the next. So this week, for example, as our delivery was about to leave the manufacturer's site in Europe, we will receive 82% of this week's allocation. And that we expect to receive by the middle of this week. But next week's delivery will be affected and will be, and Pfizer informed us this morning that there will be no shipping of the Pfizer vaccine during the week of January 25th. So whereas Pfizer's numbers will continue to stabilize in the coming weeks, things will bounce back up in February, and the numbers for the first 2 weeks of February have yet to be confirmed, but we are being assured that the doses we receive will be fairly distributed amongst the various countries. And we hope to receive an update from Pfizer this week as to the shipment we can expect during the first 2 weeks of February. And we will be able to share that with you by Thursday. We're closely following the situation. Obviously, Pfizer's goal is to deliver 4 million doses by the end of this quarter, the first quarter, so by March 31st. Now, with respect to Moderna, we continue and plan to receive 230,000 doses during January and in the coming days. And as previously mentioned, Moderna's deliveries are laid out over the next 3 weeks.
Flexibility and their patience as we work through the fluctuations of Pfizer allocations over the next several weeks. In general, we anticipate a significant decline in Pfizer supply over the next 3 weeks, followed by a ramping back up of supply. There will be considerable impact across all provinces, asymmetric across the board. The overall impact over the next month is in the range of 50% decrease of expected allocations. But this impact, as I said, will be asymmetric. This week, as our shipment was being prepared, there's minimal impact. And in fact, we're receiving 82% of what we had originally planned on receiving. And that's the distribution is currently on the way, and we expect to have this done by mid to end week. However, next week's deliveries have been deferred by Pfizer and its in their entirety. To clarify, we're informed by Pfizer this morning that that the Pfizer vaccine to Canada in the week of 25 January. It will start back up in the first 2 weeks of February to expected numbers, modified numbers as we shared last week. So about half of what we had originally expected. But those numbers remain to be confirmed by Pfizer Canada. In fact, we have regular conversations with them, and we hope and we expect to have clarity on those numbers in time for Thursday with regards to the first and second week of February. Numbers are expected to go back up to what we had originally planned, and Pfizer continues to tell us that they expect to be able to deliver up to 4 million doses of Pfizer vaccine by the end of this quarter, so by the end of 31 March. A quick word on Moderna. Moderna is delivered on a 3-week cycle. We continue to plan on receiving 230,000 doses of Moderna product in the first week of February, and the follow-on shipments are unaffected at this time, and we'll continue to provide clarity on those numbers as we move forward. Merci beaucoup. Thank you very much.
Merci beaucoup.
Thank you very much, Major General Fortin. Dr. Tam.
Bonjour à toutes et à tous.
Good afternoon, everyone.
Virtual press conference. My colleagues and I in Ottawa are trying to do our part in reducing contacts as much as possible. So there have been over 715,000 cases of COVID-19 in Canada, including 18,120 deaths and nearly 74,000 active cases across the country. So nationally, the average case count is now close to 6,700 new cases being reported daily over the past week, with a still increasing number of people experiencing severe illness. There are an average of about 4,775 individuals with COVID-19 being treated in Canadian hospitals. Over 880 of them are in critical care, and over 140 deaths are being reported each day. Canada continues to monitor for virus variants of concern. To date, the National Microbiology Laboratory has verified 23 cases with a variant first reported in the United Kingdom, and 2 cases with the variant first reported in South Africa. By now, we have seen time and again that our actions matter, as we've watched COVID-19 trend up and down and up again. And we are reminded that our actions have consequences. Every time we get a little too tired or a little too excited about holidays or thinking that vaccines could give us a quick shortcut, we are met with a new spike of activity as COVID-19 tries to take the lead again. We have also come to realize that we're not all on equal footing and that some in our communities need additional support to be able to keep themselves and their loved ones safer. Last week's National Epidemiology and Modeling Update was the latest reality check. Of course, we're all tired and want this to be over and ultimately to win against this virus. But we are again at a pivotal moment where there is a great deal at stake. As cases accumulate ever more quickly, hospitalizations, critical illness, and deaths will continue to rise. It is incumbent upon all of us to prevent more of these tragic consequences. Redoubling our efforts and not letting up is the difficult work we need to do now. The consequences of these actions are the compound benefits we all want. By suppressing COVID-19 disease activity, We're all contributing to reducing the burden on the health system, supporting our healthcare workforce in the difficult task of planning and implementing mass vaccine rollout, and giving vaccines a longer runway to begin to work as access expands to reach all Canadians. For all we have been through and all we stand to achieve in the months ahead, we owe it to ourselves and all those we have worked to protect thus far to see this through and save every life we can. Every vacation travel we postpone for a better time in the future. Every outing or activity we avoid, shorten, or limit to essentials. All the diligence we apply to hand washing, masking, and spacing helps to reduce spread of the virus. This is the tough part of the COVID-19 marathon. Together, it will be easier. Thank you.
Bonjour à toutes et à tous.
Hello, everyone. There have been over 715,000 cases of COVID-19 in Canada, including 18,120 deaths and nearly 74,000 active cases across the country. Nationally, the average case count is now close to 6,700 new cases being reported daily over the past week, with a still increasing number of people experiencing severe illness. There are an average of about 4,775 individuals with COVID-19 being treated in Canadian hospitals, over 880 of whom are in critical care, and over 140 deaths are being reported each day. Canada continues to monitor for virus variants of concern. To date, the National Microbiology Laboratory has verified 23 cases with the variant first reported in the United Kingdom and 2 cases of the variant first reported in South Africa. By now, we have seen time and again that our actions matter. As we've watched COVID-19 trend up and down and up again, we are reminded that our actions have consequences. Every time we get a little too tired or a little too excited about holidays, or start wishfully thinking that vaccines could give us a shortcut, we are met with a new spike of activity as COVID-19 tries to take the lead again. We have also come to realize that we're not all on equal footing and that some in our communities need additional support to be able to keep themselves and their loved ones safer. Last week's National Epidemiology and Modelling Update was the latest reality check. Of course, we're all tired and want this to be over, and ultimately want to win against this virus. But we find ourselves again at a pivotal moment where there is a great deal at stake. As cases accumulate ever more quickly, hospitalizations, critical illness, and deaths will continue to rise. It is incumbent upon all of us to prevent more of these tragic consequences. Redoubling our efforts and not letting up is the difficult work we need to do now. The consequences of these actions are the compound benefits we all want. By suppressing COVID-19 disease activity, we are all contributing to reducing the burden on the health system, supporting our healthcare workforce in the difficult task of planning and implementing mass vaccine rollout, and giving vaccines a longer runway to begin to work as access expands to reach all Canadians. For all we have been through and all we stand to achieve in the months ahead, we owe it to ourselves and all those we have worked to protect thus far to see this through and save every life we can. Every vacation travel we postpone for a better time in the future, every outing or activity we avoid, shorten, or limit to essentials, all the diligence we apply to hand washing, masking, and spacing helps to reduce spread of the virus. This is the tough part of the COVID-19 marathon. Together, it will be easier. Thank you.
Merci beaucoup, Dr.
Thank you very much, Dr. New. And now we are delighted to answer your questions. Thank you. We will begin a question period. And as a reminder, it's one question with one follow-up question each.
Period. Every reporter gets one question and one follow-up question. All questions today will be on the phone. Opérateur, c'est à vous.
Operator, over to you.
The first question is from, la première question est de Rachel Haynes from CTV. Please go ahead, à vous la parole.
Hi, everyone. Rachel Haynes here from CTV National News. I just want to go back to what we're talking about, how last week we were told that this was going to be equitable across all countries. However, now it seems that Canada is getting worse hit than European countries who have said over the weekend that they're now going to be getting their dosages and their vaccines restored next week. So what have the conversations been with Pfizer about this inequity that Canada seems to be experiencing, especially now as they're deferring the January 25th deliveries that we were supposed to be getting?
Before I
Well,
turn
thank
to
you.
perhaps
Okay,
Anita,
Go ahead.
before I turn to Anita and possibly to Major General Fortin, let us be all mindful that we've been very successful until now in having excellent relationships with both Pfizer and Moderna. And that's why we have been the second country in the Western world first to approve and then to administer after the UK the Pfizer vaccine. We have been the second country in the Western world first to approve and then to administer the Moderna vaccine after the US. So we've been demonstrating over the last few weeks that we are fully in touch and in great collaboration with the country that we're almost also very focused, and Minister Anand and Major General Fortin might want to reinforce that focus on the medium-term objective of securing our agreement with Pfizer, which is 4 million doses in the first quarter, that is between now and the end of March, with, as we've said earlier, the ultimate objective of vaccinating every Canadian that wants to be vaccinated by September. But Minister Anand might have something to add, perhaps to correct or to clarify, and the same thing for Major General Fortin.
Well, thanks, Shanib, and thanks, Rachel, for the question. I want to, first of all, state that I spoke with Pfizer over the weekend. I insisted on equitable treatment in terms of global supply reductions that it had announced. And indeed, Pfizer assured me and Canada of equitable treatment. Canada remains on track to receive the 4 million doses that Pfizer previously committed to arrive before the end of March. And with the 2 million doses of Moderna, which are also on track, we remain on track to receive the 6 million doses as we have previously stated. The reduction is a temporary one, and Pfizer Canada has assured us that we will have our full allotment, and I believe that Europe will also receive its full allotment. In terms of the way in which Pfizer is ensuring that it meets its quarterly allotment commitments, those are questions that Pfizer needs to answer as opposed to me, because I don't have the answers regarding Pfizer's decisions. But we have been assured of equitable treatment, and we have been assured that we will receive the 4 million doses from Pfizer as previously promised. Thank you.
I can perhaps just compliment Minister Anand's answer by saying that the discussions that we had all the way to this morning very much complement what Minister Anand has had in terms of clarifications from Pfizer. The manufacturer has reiterated that they're applying this significant reduction across the board. Some countries have been impacted more severely this week. We have not, very lightly impacted. Our impact is more severe next week. We're expecting to receive some. We're now seeing that our entire expected shipment is deferred for next week. And then the numbers will start to pick back up in the first weeks of February.
Follow-up question?
Yes, thank you. I understand about what you're saying, Major General, about some countries having been more impacted this week. However, some countries like Spain, we're seeing only about a 50% reduction this week, and then their delivery schedules, again, we're picking up the week following, whereas it seems that we're having a bit more of a reduction and no end or not as quick as an end to those reductions. But in terms of further reductions in supply, Minister Anand, you mentioned in your comments about it's possible that we're going to be seeing further supply issues. Has Pfizer made any guarantees that we won't be seeing any further reductions in their supply? Are there other options that Canada consider, like perhaps paying more for vaccines so that we don't continue to see any reductions?
Thank you so much. One of the positive moments in the conversation with Pfizer was indeed the assurance that we received that they remain on track to deliver the allotment for Canada that had been promised. And together with the Moderna shipment, we are on track for our Q1 deliveries. Having said that, in every conversation that I have with every supplier, I am reiterating the importance of earlier and earlier deliveries, including in Q1. And that will not change. Every conversation that I have, I will stress the urgency of the situation that Canada is in, and I will stress the importance of having doses in this country as soon as possible. Thank you.
Merci. Thank you. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Catherine Lévesque de la Presse canadienne.
The next question is from Canadian Press. Please go ahead. Yes, good morning to all of you. My question is for Minister Anand. Correct me if I'm wrong, but I think we're receiving 1.2 or 1.4 million doses of Pfizer vaccine between now and February, the end of February. So what about the 4 million doses in the first quarter by the end of March? Do you think those numbers are going to go down? Do you foresee any particular problems?
I will begin responding and then I will hand it over to Major General Dany Fortin. In the first instance, I think we have to remember that the shipments that we are receiving have been allocated to Canada and that chaque fournisseur essaie.
And that each supplier is trying to meet their obligations under their contracts. It's very important for suppliers and for us as well. But at this time, I don't foresee further interruptions with these contracts or shipments because we've already spoken with Pfizer as to the importance of meeting their obligations towards us.
We, in our conversation, stress the importance of sticking to the new schedule once it is ascertained and ensuring that Canada receives the allotment of Pfizer doses that it has been promised. Mais comme j'ai dit déjà,
but as I've already said, it is also important to reinforce each time we speak with suppliers with Pfizer, with Moderna, that we must receive the doses here in Canada. That is the most important thing for me. And I reiterate that every time I speak with our suppliers. And now, I will hand the floor to Major General Dany Fortin.
Merci, Madame.
Thank you, Minister. You know, since the beginning, since December 14th, we have received and delivered over 1 million doses of vaccine between Pfizer-BioNTech and Moderna vaccines, and that will continue. As I mentioned, we now have an obstacle, and the result of that obstacle is that we've received half the number of doses we were supposed to over the coming 4 weeks. Very little impact this week, severe impact next week, more severe than we were initially expecting. So let's have a look at the following weeks. There will be an increase in February, and we still expect to receive the 4 million doses by the end of March. What this will mean concretely in terms of February? Well, of course, we will have fewer doses than we were anticipating at the beginning of the month, since they will come in at a slower rate at the beginning of February, but we expect the growth to ramp up by mid-February and going forward until the end of March. So they have to respect their contractual obligations. So there will be a substantial increase in weekly deliveries by Pfizer-BioNTech from mid-February to the end of March. Let's not forget that afterwards, there will be a considerable increase of both approved vaccines over the month of April. So, while all this poses real challenges for us, we will be prepared for the second quarter of this year in terms of preparing to receive for significant increase in receiving and distributing vaccines across the country. All right, so if I've correctly understood you, in the short term, with respect to the beginning of February, we still don't know how many doses we'll be receiving from Pfizer. And my follow-up question is still for you, Minister Anand. I would like to know, Quebec's decision to delay the dose for up to 90 days, did that complicate the negotiations with Pfizer? Is that one of the reasons that explains why we're finding it more difficult to explain to obtain explanations and answers from them?
Merci.
Answer. Thank you for the question. No, not at all. During our negotiations with Pfizer, they did raise a concern, but that's not why they've reduced their distribution levels. It's due to a reduction in manufacturing in Belgium, and that is the only reason. Delivery has slowed.
Merci.
Thank you.
Opérateur.
Thank you. Merci. The next question is from La prochaine question est de Dany Fortin from CBC News. Please go ahead. À vous la parole.
Hi, good morning, everyone. Just want to ask this question to Major General Dany Fortin. You said provinces will be affected asymmetrically by the Pfizer reduction. Does that mean that some provinces will get a greater per capita share of the vaccines that do arrive? How do you decide who gets more, who gets less? Can you just break that down for us, please?
Thank you, David, for your question. When I mean asymmetric, it's due to the distribution per capita across the country that is done in multiples of trays of 975 doses. And you can only break it down so far. So provinces that were expected to receive one tray receive none. Those are receiving two, if you cut, could receive one, and so on and so forth. So the impact will be felt more in some jurisdictions due to the overall number being different from one province to the next. But we are very mindful of that impact. And in fact, there are some adjustments that are made to follow-on shipments to adjust as a result of last-minute cuts that were made at the manufacturer that saw little to no reduction in some provinces and more severe in others, and will adjust back up for a per capita distribution. So we're very mindful of that, and that per capita distribution remains our overarching principle.
Okay, thank you for that. And this is for Dr. Tam. It's a question about immunity. What percentage of immunity in the population would make it hard for the virus to find new hosts? I mean, and maybe you can give us an answer based on, immunizations that we've conducted in the past. Totally understand that, it's only been a couple months since we've had these new COVID-19 vaccines. So at what point might we expect to see the R number drop below 1? Can you provide your perspective on that, please?
Yes, thank you for the question. And obviously right now, the main focus is to provide the initial vaccines to the most vulnerable populations at high risk and frontline health providers, so long-term care facilities. So one, might expect that as I said before, in a month or two, one would hope to be able to see the individual impacts, but also the activity perhaps in the long-term care facility to begin to be reduced, but that's what we're watching out for initially. What we don't know at the moment, and I do think data will be available, but we don't know the vaccine effectiveness in reducing infection as opposed to reducing disease. So we do know that the vaccines they had amazing vaccine effectiveness against disease or symptomatic infection. We do not know if they the degree to which they may reduce infection or asymptomatic illness, in which asymptomatic infection, in which case there is a chance that people who are vaccinated could still transmit to others. That is the unknown. Overall, though, the vaccine coverage to achieve population protection or herd immunity is expected to be probably somewhere closer to 60-70%. Now, having said that, if you had virus variants more transmissible, you may actually have to have more vaccine coverage to achieve population immunity. So that's why we're conscious of the spread of these more transmissible variants.
Thank you. Merci. We will take the next question. Prochaine question.
Thank you. Merci. The next question is from La prochaine question est de Hélène Buzetti de Le Devoir.
Question from Le Devoir.
And I just would like to go back to this reduction of deliveries by Pfizer. Not so long ago, and bear with me, I don't recall exactly if it was a few days or a few weeks ago, Prime Minister Trudeau told provinces that it was not a good idea to keep in storage the second dose because we should not be afraid of delivery problems. And yet that's exactly what's happening now. So in light of this event with Pfizer, do you still think it's a good idea to administer all the doses provinces receive instead of keeping the second dose just in case?
Well, thank you for the question. I want to stress that I'm the Minister of Public Services and Procurement. So the recommendations relating to second doses are not one that are within my portfolio at all. I will turn the floor over to Dr. Tam, who's a doctor, to answer the question.
Yes, thank you for the question. So as at the outset, as we all know, this is going to be one of the most complex endeavors in public health history. And one of the reasons is, at least initially, these smaller amounts and the unpredictability of supply. Now, I think we need to anticipate the unexpected as people plan, provinces and territories plan the vaccine programs. So they need to take that into account. For sure, there had been some schedules that were provided to provinces by Major General Dany Fortin on a very regular basis. But I think one does have to prepare for uncertainties in the days ahead, as we've just seen. And so I think it is up to the provinces and territories to plan for that. The National Advisory Committee on Immunization and the chief medical officers do support some flexibility in that dose interval given extraordinary circumstances, either based on epidemiology or based on the logistics and the vaccine supply. So that's how they will have to manage it. It's not easy, but that is part of the challenge as we implement. But I mean, mostly the decisions are in the hands of the province and territories.
Well, as a follow-up, Dr. Tam, with due respect, you have not answered a question. Is it a good idea then to inject all the doses and not keep the second dose? And as a follow-up, I noticed that today you're holding a virtual meeting after 10 months of the pandemic. So I'm just wondering, why did you wait so long before switching to virtual? And should the Prime Minister and other premiers throughout the country do the same and switch entirely to virtual?
So I think, the National Advisory Committee on Immunization have provided its recommendations and also the data that we know at this point. So the vaccine effectiveness, there is actually, quite promising signs that the first dose can provide protection to the population, but that you need a second dose for, the maximizing that immunity as well as duration of immunity. So I think we will also get more information with time on the effectiveness of that approach. Right now, the recommendation is to, you can flexibly look at that interval for up to 42 days. But if that interval is surpassed, that data needs to be collected so that we can further understand this. But partly the decision is based on the province's epidemiology, where they want to cover more people, even if the first dose coverage in terms of vaccine effectiveness is not as good. There is some reasonable vaccine effectiveness, and so it's a balance between the number of people being vaccinated with the first dose and then following up with a second dose when you have the vaccine. So I think that's what the provinces are trying to balance at the moment. But that initial vaccine effectiveness after the first dose, particularly 14 days after that first dose delivery, does show some very positive direction in terms of efficacy. But it's just that there's a lack of clinical data, so data must be collected. And I think for the virtual meeting, we have been observing physical distancing in a giant room, with desks further apart, masking and hand hygiene. All of that has been observed in our on-stage virtual briefing. But we are very fortunate to have our IT colleagues help us set things up so that we can, add another additional option and layer of protection, particularly as we are in Ottawa, we're in Ontario, where the province has increased their public health measures in terms of more stringent public health measures. So we're just doing our part in observing that. But up to now, we have been observing all the other public health measures in terms of physical distancing, hand hygiene, masking, and in a very big room. Thank you.
Thank you. Merci. We will take a final question. Nous allons prendre une dernière question. Opérateur.
Thank you. Merci. The next question is from, la prochaine question est de Abigail Bimam from Global News. Please go ahead. À vous la parole.
Thanks for taking my question. For both Dr. Tam and Minister Anand, on rapid tests, Canada's Testing Task Force's report highlights that rapid testing is one of 4 priorities, but it's been months since some of these rapid tests have been approved here. Why are we so behind at rolling them out?
So maybe I'll start.
Maybe I'll start because I'll just talk about the procurement angle and then I'll hand it over to you. Is that okay, Teresa?
Yes, that's
So
great.
from
Thank
a
you.
procurement, thanks. So from a procurement perspective, let me just say that we have procured over 40.5 million rapid tests, and we have distributed a large number of those to the provinces and territories. Over 8 million, 14 million have gone to the provinces at the current time. And so our role as a federal government has been thus far to supplement testing regimes that the provinces currently have by procuring rapid tests. And we will continue to be supportive to the provinces in any way we can, not just with rapid tests, but of course with vaccine procurements and with covering the costs of those procurements as well as we have done. Dr. Tam, over to you.
Yes, thank you. So, as Minister Anand has said, that over 14 million test kits have been distributed. Certainly at the Public Health Agency level, we've been working with the province and territories, chief medical officers, experts in providing guidance to support the application of a range of tests, including rapid tests, both the molecular tests and the antigen tests. And so part of our next stage, and I think it's great that the minister has struck this expert group to further support provinces and territories as they think about how to really step up on the application of those tests. So I think that was a very welcome report. And I have seen that there's many jurisdictions right now beginning to implement some of these tests, having validated the antigen test, for example, with the existing PCR testing. So I have, in my discussion and roundtables with provinces, seen that actually increase in the application of these tests. Where it has been extremely helpful has actually been in remote and isolated communities where these tests have played a key role. But also, I think now I think at long-term care facilities and other high-risk settings is some of the key places where I expect that province territories will be rolling them out. But yeah, so I think it is important as a very key pillar of our public health response is testing as part of contact tracing and isolation. So I think that right now, as everyone knows, we're experiencing resurgence in many areas of the country. Stringent public health measures are being applied during this period. And we want to see the peak of this epidemic, and we want to see it coming down sustainably. During that period of time is when we can scale up some of these measures to just add more layers of public health measures as before people start easing things up. It's important that capacity is put in place.
And a follow-up question specifically on seniors. We know that the elderly are more vulnerable to COVID. I'm wondering how you feel, Dr. Tam, that people who are over the age of 70 who don't live in long-term care homes are not part of the highest priority groups in some provinces.
I do know that they are priorities. So the National Advisory Committee on Immunization again indicated that seniors and those certainly living in congregate settings, whether they're long-term care or residences actually for seniors, that's another retirement communities where there's congregate living are key. But it's just a matter of getting the supply in order to do it. So in the community, one may expect to start with the oldest members of our society, and then going down to younger and younger age groups by 5-year increments is actually part of the plan. So I think it's just a matter of the implementation timeline with the doses available.
Thank you. Merci à tous. Ceci met fin à la conférence de presse.
Thank you, everyone. This brings today's press conference to a close.